You know, it's a question most parents don't like to think about. What would you do if your child were critically hurt or sick?
Well, each year, hundreds of Georgia youngsters are airlifted to Children's Healthcare of Atlanta.
Health Watch reporter Beth Galvin joins us now with her special report, Angels Over Atlanta.
Lisa and Corey, when a child gets seriously hurt or sick, time is critical. The faster emergency crews can get that child to a pediatric trauma hospital equipped to deal with his or her injuries, the better the child will do. And that's where the Angels Over Atlanta come in. Seconds after midnight, 5,000 pounds of aluminum, titanium, and steel hovers above the helipad of Children's Healthcare of Atlanta at Eggleston. Carrying a patient so tiny, she weighs just over 8 pounds. Inside this isolette, 2-month-old Allie Lackey of Cedartown, an identical twin born 2.5 months premature, is struggling to breathe.
Oh God, I was so scared.
Over the last probably 12 hours or so, her breathing became more and more difficult. So during the flight, we very closely watched her respirator, making sure it's giving her the breath she needs, not too many, not too less.
My name is Allison. Hey, Miss Allison, you're a cutie pie.
Allie's parents rushed her to Rome's Floyd Medical Center after she suddenly stopped breathing again and again.
I was listening to the doctors, and here they were talking about SIDS and RSV. Oh God, I just started crying. It scared me to death, because these are my babies.
All right, Miss Allison.
Doctors at Floyd Medical Center decided Allie's respiratory distress was serious enough to medevac her nearly 100 miles here to Children's Healthcare's Pediatric Intensive Care Unit at Eggleston.
We're used to seeing kids that are this sick, and at outside facilities, they may see a child this sick, once every 6 months.
Right away, the team goes to work trying to figure out why Allie's breathing so erratically. Her twin and another sister are also sick with a respiratory illness, so pediatric critical care doctor Atul Vatt suspects Allie may have an infection.
Having been born premature, she was already behind the 8 ball, and so she just doesn't have a mature immune system, so we have to be on top of it right away.
Tests show Allie is suffering from complications of both the influenza virus and pneumonia. Within days, her twin sister DJ will also be hospitalized here, but Stacy Stinson gets her miracle. Her baby girls are going to be okay.
Twins run in my family, but out of 3 generations, my twins will be the first one to actually survive.
With Allie out of danger, the flight crew heads out for another mission.
We're going to Gainesville now to pick up a cardiac child.
You departed at 0004.
This time to Northeast Georgia Medical Center. This time the patient coming in is a 4-month-old boy, and he was born with a heart defect. They're concerned about him because it appears that his heart is starting to fail, and they need to stabilize him. Joseph Cordew, who was also born premature, is critically ill.
Every second counts, so I was glad that they called for the helicopter.
His parents say Joseph seemed healthy until he stopped eating.
He didn't respond to us. He didn't even cry.
Then Joseph got even sicker.
I think he had a seizure, and we called the ambulance, and they took us to the hospital.
The important thing tonight was to stabilize Joseph's blood pressure, make sure Joseph was getting enough oxygen to his brain, his heart, the rest of his organs.
Joseph's little heart can no longer pump properly, and the critical care team is worried.
His heart is strained, his body is strained.
In the end, Joseph could not survive the metabolic disorder that caused his heart to fail. He passed away at Children's Healthcare on October 26th. Able to move at up to 190 miles an hour, Children's Response Air takes on some of the toughest cases.
What we have here is our heart monitor, which also monitors blood pressure.
It's a flying intensive care unit.
We have our IV pump, which we can run 3 IVs on. Our ventilator, which helps us ventilate our patients. Oxygen. In this bag here, we have intubation equipment for putting a breathing tube down in the patient.
On this night, 4-year-old Danielle Rodriguez arrives from Gainesville, having an asthma attack.
En route, he was pretty calm, slept most of the way. He was kind of looking out the windows, checking out the scenery.
¿Estabas asustado?
Asthma is the most common reason that pediatric patients are transported to Children's by air ambulance, because even when they're stable, like Danielle, they can take a turn for the worse.
Meaning that they look like they're doing well, but then they can deteriorate. Their condition worsens very fast without you really expecting it.
By the time his mother and father arrive, Danielle is on a breathing treatment and doing much better. He'll go home in a couple of days, healthy again. His big ride in the sky, just a memory.
Joseph Cordu's parents decided after his death that they still wanted to share his story, even though they are grieving, and we are grateful to them. One of the unique things about Children's Air Response is that the helicopter is big enough to allow a parent to ride along with the child. So mom or dad can even use a headset to talk to the child and calm him. And hearing that familiar voice can make a really big difference for a child who is in pain or a child who's very frightened by, there's a lot of noise, there's a lot of movement, a lot going on. It can be terrifying to a kid.
Very traumatic experience. Yeah. Now, are most of the patients transported children?
Well, they can do anybody from sort of a newborn infant to somebody who's 21 years old. So they handle and see just about everything. Accidents, very sick children, children who are asthmatic. And the equipment they talked about, they have blood pressure cuffs that are so small they could just fit right around your finger, all the way up to adult size. So they vary and see everything.
Wow, it's an amazing program.
Yeah. Thank you, Bash.